The Healthcare Security Cast is sponsored by 3D Network Technology. Reliability is our core value. Visit www.3dnetworktechnology.com. And by Genetec, delivering security strategies for healthcare. Visit Genetec, that's GENETEC.com. And by the Change Execution Group. Visit 360lifetransformations.com. Before we get into today's show, I want to invite you to connect with the Healthcare Security Cast on a new platform. It's a text-based platform called Community. To join, all you have to do is text my community number, and that number is 647-372-2042. That number again is 647-372-2042.
Welcome to the Healthcare Security Cast, the podcast dedicated to healthcare security, safety, and emergency management. If you are involved with a healthcare security program or desire to be, this podcast is for you. Join the conversation as we discuss the issues that matter to healthcare security professionals while leveraging the expertise of healthcare security thought leaders and experts in personal development. And now, here's your host, Brian Hamilton.
Welcome to the Healthcare Security Cast for Saturday, October the 17th, the last day of Healthcare Security and Safety Week 2020. I'm happy to share that thanks to the engagement this week, the Healthcare Security Cast has been downloaded a total of 8,000 times in 110 countries around the world. So thank you for the support. Thank you for taking the time to recognize our healthcare security heroes. Thank you for listening, and thank you for sharing. One of the key takeaways from this week is that recognition is something that needs to happen throughout the year, and not just on a week that we designate. Although we use this week as a special occasion to celebrate our healthcare security heroes, we want to make sure to celebrate them throughout the year as well. Even though Healthcare Security and Safety Week is completed, I'll still invite anybody who has recognition to share of any of their individual contributors to go ahead and do so. If you have anyone you want to recognize, if you have ideas for the show, if you want to get every update, be aware of every contest that we're running, every giveaway, send me a text at 647-372-2042. That's 647-372-2042. And we'll be sure to recognize any of your staff and keep you aware of everything that's happening. Now let's start off our recognition as we have every day this week, being joined by Sarah McVanel of Greatness Magnified, Canada's recognition expert, who will share her recognition tip of the day.
This is your Healthcare Security and Safety Week recognition tip of the day. To round out our 7 days, let's talk about one of the biggest challenges that I hear from my audiences, and that is, how do we deal with people who are negative, complainers, pessimistic, and just generally pains in the, well, you know. Well, what I like to share with them is that a complaint is merely a poorly worded request. This individual is clearly frustrated, is unresourceful in that moment, or maybe even simply has very legitimate reasons to be concerned. So what if in fact you listened behind the negativity to where there may be a strength underlying that? Here's an example. What if somebody in a staff meeting kept telling you why the new schedule wasn't going to work? Maybe they're a huge problem solver. Maybe they're incredibly detail-oriented. Perhaps they're the ones who have been through this before and know why it's not going to work. We often shut those folks down and don't listen to it because, frankly, we're worried that if we pay too much attention, it's going to create this ripple effect of negativity. What I invite you to do as a leader is to listen for where their strengths and their aspects of greatness show up so that you can acknowledge that and then tap into it. If they're detail-oriented, okay, great. You know what? Let's dive into the details about why you're concerned about that. Let's take that offline. Thank you so much for pointing out there's a few logistical things we should be considering. It will diffuse that person's negativity, and also it allows you to leverage the expertise that you have on your team. My name is Sarah McVanel, Canada's recognition expert. Thank you so much for what you do every single day to lead teams to make our Canada safe.
Thank you, Sarah. And to hear more from Sarah McVanel, listen to episodes 24 and 39 of the Healthcare Security Cast, which can be found at brianhamilton.com/podcast. Can also be found on Spotify, Deezer, iHeartRadio, Apple Podcasts, Libsyn. We're on almost all of the major podcast carriers. And also, check out our website, greatnessmagnified.com. That's greatnessmagnified, all one word.com. There's lots of free resources there to help you recognize your teams effectively. And now let's get into today's recognition.
My name's Kim Hefferman. I'm a shift charge officer with North York General Hospital in Toronto. Thanks for having me on, Brian, for Healthcare Security and Safety Week. I just want to give a shout out to my entire team and department at the hospital. We have six sites in our network, 2 of which are COVID testing centers. And since the pandemic started, we've seen a significant increase in our calls. The early stages, we were at about 400% increase in our call volume, and it's pretty much kept on that same trend. We've had a big increase in our mental health patients. I'd say overall, the pandemic's caused a lot of stress on our staff, both personally and professionally. And security in the healthcare industry has become even more fluid than ever. So the entire team, from our manager to our pandemic coverage guards, has all stepped up. They continue to step up and rise to the challenges on a day-to-day basis. And I tell them all the time that the acquiring on a daily basis by working in healthcare is going to prepare them for any career path that they choose. And like I said, overall, just everyone deserves a huge shout out and a huge thank you for what they do on a daily basis, because I really don't think security gets enough recognition for what they do.
My name is Shawn Carter. I'm the market manager of security for the Valley Health System here in Las Vegas. I'd like to recognize the team, the entire security team for the Valley Health System, specifically our management staff. So our account manager for Allied Universal, Vidrio, and Keshawn Williams for helping us get the training program up and running, not only the Healthcare Security Officer Academy, but our Field Training Officer Academy as well. Gosh, I don't know where to start when it comes up to all this, but every single team at every single one of our facilities does an amazing job. And without them, we really do not have a security program. So thank you all for the efforts that you put in and day out. I can't be any more lucky to have a great security team like we do here at the Valley Health System. So thank you, and I hope you enjoy this week of appreciation.
Hi, everyone. This is Sarah Miller, Operations Center Manager and Healthcare Specialist with GardaWorld in Scarborough, Ontario, Canada. This Healthcare Security and Safety Week, I'd like to give a shout out to my fellow executive officers of the Ontario IAHSS chapter. Sergio Angelucci from West Park Healthcare Center, Brad Stewart from Grand River Hospital, and Fayez Bilal from Women's College Hospital. Thank you for your dedication to the industry and for leading IAHSS in our beautiful province. And to all of the local members as well, thank you so much, especially to Martin Green, Noreen Milne, Todd Milne, and Paul Greenwood, who are such vocal advocates for the advancement of healthcare security in Ontario. And you yourself, Brian, this organization wouldn't be the same without you. You're all healthcare heroes.
Hello, Dustin Banks, Director of Support Services for University of Utah Health, Salt Lake City, Utah. Really appreciate the opportunity to come on today with Brian and to acknowledge the hard work that our officers have been doing, not just this week, but every day. University of Utah Health has currently 104 security officers, which every day they are put into situations to make quick decisions and hard decisions that they do very, very well. And they have been, over the years, grown into what I like to say within the hospital, they're kind of on a celebrity status within the hospital. And the nursing staff and physicians love the security team, and we can't thank them enough for all that they do and that they will continue to do. Recently, as with everybody else, they've been forced into a different environment with COVID, and we've asked them to do a lot of different things and be very flexible, and coming from requesting people put their masks on to making sure that people are putting hand sanitizer on. And then we threw in, hey, we're not going to allow visitors. And every single day, these officers show up with a smile on their face, ready to go to work with whatever changes we have for them. And we can't thank them enough for the work that they're doing. And then most recently, within the last week, we hosted the vice presidential debate on our main campus. And all of those officers were able to commit to having overtime shifts, with the understanding that they were here to make sure that we were safe for whatever came our way. And a couple of folks that really put in some extra hard work, Rolynn, He's one of our supervisors that does all of our risk assessments, put in probably 60 to 80 hours additionally, put together a nice incident action plan that, thank goodness, we didn't have to really use, because the hard work and the prep and the planning that went into it, it kept us safe. So we greatly appreciate the efforts that Rolynn has been able to do, as well as all the rest of the team members that from our training program and education to our management team. They are all committed to keeping us safe, and we really, truly appreciate all of their work. Again, not just this week, but every day.
Thank you again to everyone who took the time to recognize their teams and individual contributors. I know it was a busy week, and I saw a lot of great things happening around the country. And again, I want to remind everybody that the recognition doesn't have to stop here. If you have anybody you want to recognize, we can recognize them on the show. We do a podcast at least every week. And the easiest way to talk to me about that recognition is just to send me a text message at 647-372-2042. That's 647-372-2042. And before we wrap up today, we're going to be joined again by Chris Littlefield, who will share the last of his 7 tips for creating a culture of appreciation.
Hi, I'm Chris Littlefield from Beyond Thank You, and here are 7 tips for nurturing a culture of appreciation. Tip number 7, ask people what they're proud of. Most of the time, especially when we have frontline workers, we don't see what they're dealing with every day. We don't know what they're proud of. We don't know what it takes to do their job. And we can go in and we can share what we observe, but most of the time people want to be appreciated for what we don't see. So this week, reach out and ask people, hey, what are you proud of that I don't see? What are you proud of the last couple of months? What was the craziest situation you had to deal with, and how did you deal with it? And ask them what they're proud of. Let them share, ask questions about it, and then acknowledge them for whatever they shared. Because usually people don't want to be acknowledged for the result that we see. They want to be acknowledged for the process that led to producing that result. Once again, I'm Chris Littlefield, and those are my 7 tips for nurturing a culture of appreciation at work.
Thank you, Chris. And to hear more from Chris, check out his website, beyondthankyou.com. That's beyondthankyou, all one word, .com. Join us again on Tuesday, October the 20th, when we're joined by Gene Eaton. We've had a lot of conversations about how to make your security program invaluable, and if you want to do that, you definitely want to tune in on Tuesday. Thanks again for listening, and I just want to remind you of all the ways to connect with the Healthcare Security Cast. Send me a text at 647-372-2042. That number again is 647-372-2042. You can follow our page on LinkedIn. You can join our LinkedIn group, the Healthcare Security Cast Community. You can join our Facebook group and also follow our Facebook page. You can follow us on Twitter. The Twitter handle is at HCSecurityCast. Follow us on Instagram at the Healthcare Security Cast. Check out our website, brianhamilton.com, and connect with me on any of the platforms. Again, I'm the only Brian Hamilton. That's BRINE on any of these platforms. Thank you again for tuning in. I appreciate every one of you. And until next time, stay safe and take care.